Welcome back to Dojo Live. This is Tulio Siragusa. I'm broadcasting from Southern California. Today is Tuesday, March 16th, 2021. I'm joined today by my co host, partner in crime, Carlos Ponce in Cuernavaca, Mexico. Hey, Carlos, welcome back.
Thanks.
And
It's a
of
pleasure to
course,
be here, Tulio.
we have our guest today, Livia Keseman, who is with um, 28 Health. And we're going to be talking today about something that is of interest to many of us. Me personally, I've been a supporter for women movement for a long time, especially underserved women. And so we're going to be talking about improving the quality of care for underserved women. Before we get into that topic, let's get to know Livia a little bit, and perhaps you could take a few minutes to introduce yourself to the audience. Thanks, Livia.
Sure. Uh, Very nice to talk to both of you. I'm very excited about being part of Dojo Live. A little bit about me. My name is Livia. I work at 28 Health. My background is in biomedical engineering. I've always been passionate about healthcare. This is why I chose that track. And I think that with tech and by being an engineer, you can really conquer the world. So this is why I chose biomedical engineering. Then I started working in a company called Ion Beam Applications, IBA, who are building proton therapy centers. So, in a couple of words, proton therapy is a new version of radiotherapy, which is more precise. And so it's cancer treatment, and it's especially relevant for kids and for specific tumors. I worked there for 5 years, did many, many things over there. It was back in Belgium. After 5 years, I applied to a grant, which is called the Prince Albert Fund, which is I would say, an equivalent to the Belgian 30 under 30. And the goal of this grant is to help young, and I'm air quoting this, high potential Belgian people to help Belgian company to go abroad. And so I help a company called Byteflies to go to the US. I worked with them until June last year, and this is when I switched to this new company, 28 Health.
Excellent. Nice to meet you. I know you're broadcasting from New York today. So tell us a little bit about 28 Health.
Sure. So at 28 Health, our mission is really to increase the access to reproductive and sexual health for underserved women. And I want to focus on underserved women because we think those are the people that really, really need our technology the most. And so how does it work? What do we do? Well, today, any user can go on our website, and we're focusing on women, and those women will answer a medical questionnaire about a couple of things about their health. They're going to tell us what they need. They're going to tell us who they are, etc. This medical questionnaire will be reviewed by one of our doctors. And then if the doctor has any questions or if the user has any question, they can communicate either via messages or they can also schedule an audio consultation. Everything is obviously done via telemedicine. Once everything is okay, the doctor will write down a prescription, which will be sent to our pharmacy partner, who will dispense the medication and ship it to the door of the user. And this is a full comprehensive way for the user to get access right now to birth control, but in the months to come, also to many other medication in reproductive and sexual health.
Great. Well, sure. You got to have a start somewhere, right? So
Of course.
it's very appropriate this month. We're celebrating women, international women, and especially women in tech. That's something that we've been posting almost on a daily basis. The Women Hacker video series that Ancora has been putting out. So we're excited to speak with you about this topic and also speak to a woman in tech. So, Carlos, let's get right into it. Let's introduce the topic and dig in and see where this takes us. Carlos? Carlos might be delayed. I'm not sure. He might be delayed. So I'm going to go ahead and introduce the topic today. We're talking about telemedicine and women's health, how to increase access. And the topic you chose was leveraging tech to enable better access and quality of care for underserved women. So, Livia, tell us a little bit about why you chose this topic. Maybe help us understand the severity or the scope of the challenge that you guys are taking on with improving the quality of care for underserved women. What does that look like? What is that solving? How big of a problem is it?
So that's a great question, and as I'm sure you guessed, it's a huge problem everywhere, and especially here in the US. So today, just to give a few numbers like this, there is it is not required in 33 states to have sex education at school, which is just just the basics, and those are not taught to children who would need it. So that gives one first aspect. Second thing, we have in the US 19.7 million women who are in a contraceptive desert. That means that they have no easy access to a hospital, to a doctor. They have no easy access to get birth control.
Okay,
And
I'm
this is
sorry to interrupt. Repeat the number again. How many women?
19.7 million.
19.7 million. This is just in the US or worldwide?
This is just in the US, and those are only women
I mean,
between
that's
13 and 44.
that's like 8% of the entire US population. That's huge. Okay,
It
please continue. I just wanted to highlight how big of an issue this is. Please.
Yes. And so this is really why we want to bring a solution that can be used by anybody, anywhere. We're currently in a certain number of states, and we keep on growing. And the goal is really to help as many women as possible. So yeah, that's just an overview of the problem right now. Also, other solutions exist on the market that kind of do the same time of telemedicine medication delivery, but no one is focusing on that population. So that's why we really want to focus on Medicaid users as well as uninsured users.
So break this down for us. Let's assume I'm a woman in a marketplace. I don't have insurance. I don't have a primary doctor. And there's 19 million of us. How do we go about improving the quality of care? How does this work? What do you provide? I know you have a questionnaire you mentioned to get an assessment of what their needs are, but you also deliver the medicine to them. Who pays for that? Can you walk us through the ecosystem you've created to serve this marketplace?
Sure. So we have several solutions for uninsured people. First, we try to have the cheapest solution as possible so that it can be affordable for as many people as possible. So our lowest cash brand is at $18 a month. And this is something that many of our users use. We also have partnerships with great nonprofits such as Bedsider, who will help those users to be able to pay for this medication where they are not able to do it themselves. And so it's really through partnerships that we try to bring the access to as many women as possible.
So question, why did you guys choose the birth control marketplace first? Is that one amongst the underserved women, and the 19 million underserved women, is that the biggest challenge? Is that what kind of impact is that having on their health? Just trying to bring some highlight, if you could, on why went down that path and what's next.
Of course. So yeah, it has a huge impact. Birth control, being pregnant, having a kid, it's a life changer. Not only from a personal way, but also more from a economic way. It's something not everybody can afford having many children. And so a couple of months ago, I had a user on the phone, and she was telling me how important the service was because she really just couldn't afford any other kids. It was very difficult for her. She didn't have access to healthcare, and so it was really a life changer for her.
Livia, I have a question for you. I hope that you can hear me. I'm sorry about when we began because I had a connectivity issue. I couldn't announce the topic. Thank you, Tulio, for stepping in. Hopefully you'll get me right. Livia, I'm curious about something. It's just sort of like a continuation of the intro conversation we've had recently, and I'm wondering in this context of health and health. How can I say this? Well, tech health or health related matters. What sort of changes or behaviors have you seen that have been affected, or what sort of situations in families or for women as a whole would you say that have shifted or changed or morphed somehow during this time that a lot of people in the US have, well, across the world, but specifically in the US, have had to stay at home? How has the repeated lockdowns affected people and women especially in health matters? How would you say to that? I'm curious, please.
It's a very broad question, and I could give so many answers. But one thing that I can say is that first, at the beginning of COVID, we saw a huge decrease in the number of people going to the doctor, cancellation into consultation. And globally, this is very bad for the whole healthcare system because you shouldn't just have your medication and go to the doctor only when it's an emergency. And then what we saw is a very big shift into telemedicine. And so numbers are really, really big. About 30% of all consultations in the US were done via telemedicine during the COVID year, which is a huge shift in mindset, really huge. Also, something that we saw is that in 2019, 11% of people said that they would use telemedicine, and now we're about 50%. So really, I think this mindset was previously originally it's due to COVID, but I'm really hoping this is something that is going to stick because it opens healthcare to so many other people who don't have the time to really go to the doctor.
Yeah, and also in specifically in the tech space that has had to focus on telemedicine, for example, there's been a lot of effervescence. There's a lot of activity. There are new tools and strategies out there that are helping people to communicate with their doctors and to receive either treatment remotely or medicine. So in the case of underserved women, have you seen would you say and I'm just saying this loosely, okay, from the layman's point of view, how have you witnessed that this particular segment of the population, I'm talking about underserved women, has easily adopted these changes that have surfaced or boomed amidst a pandemic?
So I think really the barriers that those women face on a daily basis, not having the time to go to the doctor, not having the time to commute, not being able to schedule a meeting with a doctor, all of those got even bigger barriers during COVID. And even bigger, especially for that population. And so that's why I think that we saw a huge increase in need and in demand from those population, because they really look for a solution that is adapted to their needs specifically.
Okay, thank you, Livia. Okay, there's a few more coming up, but Tulio, please.
Yeah, I'm curious in terms of using technology. What is it about the platform that you find to be unique in terms of making it easy for this communication to take place? Is it on an app, on the web? Do you allow phone call? How is that working? What kind of platform? What does the platform look like?
So we have a really everything is on the website. It's a web app, and it's really, really easy to understand. And so I'm going to say that from someone whose English is not a native language. I think the whole website, the whole medical questionnaire is really, really understandable. And I'm insisting on that because sometimes medical question can be a bit tricky, and we really try to make it as understandable for everybody as possible. So the user will really go on the website and go through the questionnaire, which is easy to understand. And then everything will happen via the dashboard that they have on that website. And so that's where they will be able to communicate with the doctor. That's where they're going to see some updates about the delivery. They will also be able to communicate via email with our ops team. And so they really have that one place where everything is happening.
Excellent. So we talked about this was a starting point for your company. What are some of the potential future efforts to expand medical care or treatment for this marketplace? Have you guys thought about some additional capabilities? What could those be?
That's an excellent question. And actually, I'm going to give a little bit of background. So what I'm doing in the company, I'm the strategic projects manager. So I'm in charge of two main projects and some others that are not interesting for here. The first one is the state expansion, and the second one is the product expansion. So if I go first into the product expansion, currently we're doing contraceptive, but we want to go really to more reproductive and sexual health. In that, we can find STI testing and medication. We could think about herpes, yeast infection. We have many options, and we want to bring as many solutions to our users as possible. And then from the other side, we are launching more and more states. We just announced that we launch on the West Coast and in the Midwest. And this is very, very exciting because we want to bring our solution to as many women as possible.
Fantastic. So you just joined the organization this June. So it's
Correct.
been about 8 months, 9 months. What's the culture like in the environment? How big is the company? What are some of the things you're discovering that makes it an interesting place to work?
I mean, it's an incredible place to work. We are we're still a startup, so it's still a fairly small team. But one of the big difference I've noticed is that everybody is really, really, really motivated by the mission. An example that I can give from that is every Friday we have a team meeting where we just give the business updates to everybody. And one section of that is just going through the feedbacks that we received from users. And we can read the stories of those users. And so I would say this is the first big thing. Then another thing, people were telling me, you're going to work in New York, you're going to work in the US. No one is eating lunch. You eat lunch while being on the phone, while working. But actually, the culture of the company is so nice. And so we really spend the time. And I'd like to say that I arrived in the company during COVID. So that's very weird as well. I've never met my colleagues. However, I feel like some of them could be my friends. We get along super well. We organize plenty of activities to really stay connected. And so I'm more than happy to be a part of this company.
Livia, I got a quick question here too regarding the let's call it the operational aspect of 28 Health. What I'm seeing is that you have a service or a company, a platform that has different components. On one end, on one side, you have the end user or the client, and then you have the providers, you have insurance companies, you have I assume that because you do delivery, you have logistics and transportation, and or things like that. So considering the overall picture of the company, what would you say that, and tying into your role as a project manager, what would you say that in this day and age is the most challenging aspect that needs to be overcome in order to better serve your customer base?
I think that's one thing that we will still need to fight for and continue improving on is continuing to go further and further into the number of women that we can reach. Today, we are in already many states, but I really wish that we could be in more, and we're working on being in more. And actually, something that is a bit difficult is that state legislation regarding telemedicine is very, very different. So you would go from one state where you can do everything through an online questionnaire, and then on the other end of the range, you have other states where you can't even have a prescription written without an in-person meeting. And so this is something where we really need to understand each state regulation and try and go further and further.
Okay, and well, that's about the operational aspect or the logistics, and specifically about the tech aspect. What do you think that needs to or could maybe get better in the future, or what has worked well, what hasn't worked so well? In general, what would you say about the tech component of 28 Health? What sort of let's call it stumbling rocks that you have had to put aside in order to have it work seamlessly operationally?
I think one of the big steps that will help us move is to include the video in our app, which we currently don't. So currently our system is medical questionnaire with an optional audio consultation and with messaging. Adding the video to that, which is obviously a higher text challenge, will really enable us to talk to many more women.
You're talking about live video feed, right? That's what you're talking about, and the same for audio.
Yes.
Interesting. That's where I can sense that that's where it's going to get really, really interesting. Yeah, because there's a lot of moving parts, and so yeah, look forward to that. So yeah, back to you, Tulio, please.
Yeah, this is very eye-opening. I mean, the challenges you guys are taking on. Not only is it a pretty big problem, but then when you make it available, you have also some of the legal blockages that make it hard. Why is it that some of these states can they make exceptions? Has it changed a little? Have they loosened up, as for example, as a result of COVID? And is there anyone lobbying for making these changes at these state levels where there's still undeserved women in these states that are not getting the care that they need? And the only limitation from what I'm hearing is a legal one that already has precedents in other states, but that's not an issue. How do you guys work through that? Is there some representatives that are pushing for changes? Any updates on that?
So yeah, I mean, that's definitely one of the trickiest things, and something that we have seen and that I think is very encouraging is state legislation changing during COVID, really allowing telemedicine, being able to talk to your doctors without going to the hospital. Those changes are supposed to be only for the COVID time period. However, in some states, we see them changing. We see them making it permanent. In New York State, Governor Cuomo just decided to make it something that will not change in the future, that telemedicine should be accepted overall. I hope that this change is what's going to happen in other states and that we will open more and more telemedicine. And with the numbers that we see, as I told you before, 30% of the consultations last year were done through telemedicine. I can only see it going into that direction.
Excellent. Well, we wish you a lot of success with that. We certainly know the absolute need for these kinds of services, and technology definitely makes access easier and simpler. So we're encouraged by that, and we congratulate you guys for the success you're having, and hope that you continue to expand on that. As we part ways today, as you've had an interesting background. You lived in different countries, and here you are now dealing with the U.S. market and tackling a very important issue. Is there anything that you have any words of wisdom in terms of what you've learned so far that we could perhaps learn from other countries or vice versa on how to better serve patients in the marketplace?
That's a very good question and a difficult one to answer because healthcare. I've worked in Europe and I've worked in the US, and those are two fundamentally different markets for several reasons. I think one of them is reimbursement. In one place, it's public. So in Europe, it's public. It means that much more people have access to healthcare. However, it also means that any technology advancement, anything new is much more difficult to bring on market. US is the exact opposite, where everything is reimbursement is private. I mean, not all reimbursement, but most reimbursement is private, which means that it's much more technologically savvy, and we can see that the patients are eager to have some new technologies. However, the access is much less. So it's really difficult to find the right balance between those two things because you want to have the best available healthcare for everybody. And so I think this is something that we should all work on.
Yeah, that's definitely an interesting. And I think technology is what bridges the gap on those cost of delivering services and even patient care. So hopefully, with the more privatization that we have and more competition on the technology sector, that reduces the cost of goods as well and improves quality of service overall. Maybe Europe can take some lessons from that, and maybe we can take some lessons about making access to everyone too. So who knows? We'll see what happens. It's been a pleasure to have you with us, Livia. Thanks for joining us. Just stay with us as we go off the air. Carlos, what do we got coming up for the rest of the week?
Oh, absolutely. We have two more conversations, Julio. Tomorrow, we'll be speaking with Brad Hollister and Jason Swanson, the CEO and co-founder and CTO, respectively, of Swan Leap, and on the topic of from Craigslist to the Inc. 500 lists, revolutionizing shipping and logistics technology. And then on Thursday, we are going to be speaking with Ariel Lopez. Wait a minute. I'm sorry. With Ariel Lopez. Yes, I was right. From Net.io, a talent evaluation platform for recruiters. So that's what we have remaining for this week. That's tomorrow, and then on Thursday, right here. By the way, the one on Wednesday is the one at 10 a.m. Just so that you know, it's not the one at 12 noon. It's the one at 10 a.m. That's the one tomorrow. That's what we have, and then of course the recap show on Monday.
Exactly. So everyone, you could check out the site. We have a add to the calendar button now on every episode. You can easily click
and your
on
comments.
it.
Don't forget the comments.
Yes, and we want to hear your comments as well. But you can add it to your calendar. If you see a show coming up that you really want to hear, we've added that feature recently, so you can have it and can remind yourself. And if you like what you hear or you have a question, put it in the comments. We'll respond. Thanks for being with us. Stay safe.